Hi everybody, I'm Dr. Namrata working at Cutis Skin Studio as a consultant. As you're seeing, nowadays we are seeing many patients for hair fall, hair loss. As you're seeing one of the patients sitting over here. Many of these patients feel that they can treat their hair fall problem with the help of shampoos, conditioners and different kinds of oil which are being advertised widely nowadays. But as we all know, it's never effective for a long term. So we at Cutis treat these problems in a very scientific manner with the help of treatments like we have PRP, it's a choice of treatment for controlling the hair fall. Then we have another treatment called as stem cell, wherein we use different kinds of stem cells. Then we have an autologous stem cell, wherein it's very effective because you are using your own stem cell which are less chances of rejection. And the very important and a good treatment called as hair threads. Hair thread is a treatment which can be a choice of treatment for people who don't stay over here. No? They can do it once in 6 to 8 months. Hi,
good
what's your good name?
Dhaval.
Tell me, what's your concern?
I have a terrible hair fall and I'm losing a lot of hair since like past 9 to 10 months, or probably you can say a year, as I'm on a heavy crash diet.
Okay.
Probably that's the primary reason I feel that I'm losing my hair.
Okay.
So I need a...
You tried any treatments? You tried any...
I have tried few cosmetics, probably some oils and shampoos, but nothing is helping me out. I really need to...
Okay. Any major illnesses for last 6-8 months? Any malaria, typhoid, any kind of fever or...
No, not really.
Nothing. Okay.
Yes.
Anything else you can relate apart from your weight loss, like you've undergone any surgery or anything?
No, not really.
Nothing.
No.
Okay. See, basically for every individual there is a rate of hair growth and there is a rate of hair fall. Now in your case, what I can see, the rate of hair growth is reduced and the rate of hair fall is increased. That's the reason you can see thinning. That's where the thinning starts. Now your thinning is obviously seen. That's where you come here to seek a treatment. Now in every individual, the reasons are different for both the things. But the first thing which needs to be treated is to control the rate of hair fall. For that we have different kind of treatments. So that will actually involve you to come here once in 15 days when we do those treatments. Now to begin with, we have mesoscalp, wherein we give the multivitamins directly into your hair follicles with the help of a dermatologist. Okay, it's hardly like a insect bite kind of a pain. It's not very painful. It's bearable. It has to be repeated every 15 days. Now apart from mesoscalp, we have a treatment called as PRP, that's platelet-rich plasma. In this treatment, we just take 8 ml blood from your body, separate the WBCs and RBCs with the help of centrifugal machine, and we have a serum which is rich in 8 kind of growth factors, which is called as PRP, that's platelet-rich plasma. Now we administer this solution on the scalp to ensure that your scalp becomes healthy. So whatever reason, changing climate, hair fall, any stress gives you hair fall. So all these things can be tackled because these are the inevitable parts of our life. So at the same time, we don't want to lose hair the way at the speed that you're losing. So these treatments will control your hair fall. But what I can see, I can examine, you have good amount of thinning happening. So it's not only the hair fall need to be reduced, but also you need to have a new hair growth. So for that we have a treatment called as autologous stem cell. Autologous stem cell is a treatment wherein we take your 2 to 3 hair sample with the bulb, send to the lab, and they kind of grow the stem cell out of it. Are you aware what a stem cell is?
No, not much.
Okay. Stem cell is basically a cell which has a capacity to multiply, it has a property to multiply. When we were in our mother's womb, one of the stem cells multiplied to become lung, heart, kidney. All our organs are made up out of stem cells. So coincidentally we don't have your stem, basically placental material where we can derive the stem cells, but we can derive now the stem cells from your hair bulb. So what we do is we send these stem cells which comes from the lab is found in the form of a solution. So how we do PRP, as I explained you, with the help of dermatologist. Similarly, we use this stem cell also on the area where we need new hair growth.
Okay.
So they are done in one PRP, one stem cell at a gap of 15 days, which will ensure not only control hair fall but also take care of the new hair. So this is how the complete treatment can be taken care of, both the factors.
Okay.
Apart from this, if you say, no doctor, I cannot come every 15 days, I don't stay over here, then we have an option called as hair thread, wherein these hair threads are very fine needles, insulin needles, which normally people take to take diabetic patients, take it for insulin. Now these needles, we have 20 to 30 threads at a time which we insert. Now these threads also take care of your hair fall up to some extent. So for people who cannot come regularly for the other treatments, once in 6 to 8 months is what we advise, 20 to 30 hair threads depending upon the seriousness of the problem. So this is also an option which you can think about.
Okay.
Hi, I'm Dr. Zeba. I'm a consultant dermatologist at Cutis Skin Studio. We specialize in lasers, and laser hair removal is one of the most commonest lasers practiced today. I have a patient with me who wants to do laser hair removal but has a query whether shaving prior to laser hair removal makes the hair thicker or increases the hair growth. This is one of the most commonest myths that we see, and the shaving does not in any way increase the hair growth or make it thicker.